Hi, I'm Dr. Felice Gersh, your integrative OBGYN. For this episode, I am going to talk about a topic that comes up all the time when I speak to other doctors and patients: cyclic hormone prescribing. Now, first I'm going to start by talking about how most doctors are prescribing hormones and why that is, and why I try not to prescribe it that way, and the whole beauty and purpose and benefits that are achieved by giving hormones in a cyclic manner. Well, first of all, how do most doctors who are prescribing hormones give them to women, and why would they give them that way? Well, first of all, unfortunately, most doctors who are prescribing hormones really don't understand exactly or even approximately how they work and what the real benefits are when you provide them in rhythms and doses that are reasonably physiologic. By that I mean something that you would find actually in a healthy, young, reproductive-aged woman. Because it turns out that practically a whiff of estrogen of any type, even endocrine disruptor type estrogens, will actually lower the degree and the amount of night sweats and hot flashes, which is wonderful, because night sweats and hot flashes, the most common symptoms that women experience as they go through menopause, are really horrific. They are actually now associated with an increased incidence of everything bad, including things such as heart attacks and strokes and probably dementia as well. So we don't want to let them go unchecked, let them go untreated. So they give what? They give a tiny amount of estrogen, usually, although not always, estradiol, often, but not always, given transdermally, because they don't know. They don't understand that there are different types of estrogens and that different estrogens work differently on the different receptors. And so they just know that whatever they give, it seems to help. And that is true. And what do they want to do? They want to avoid bleeding. They don't want to have anything that even is a semblance of having a period. They think that women will do anything to avoid having period type bleeding, that's the one good thing about being in menopause, and they're not going to give it up. Well, there are a few women like that. That is true. But most women, when they understand what it means to bleed, why they would want it and even embrace it, they really change their mind. So if the goal is simply to alleviate night sweats and hot flashes, then that old adage, which is still prevalent, the tiniest dose, the smallest dose, is the game plan. So that's what they give, the very smallest dose. The problem is, although giving the tiniest dose will help with night sweats and hot flashes, and you can give it in any form, oral or a pellet, or you can give it transdermally, the best way, you don't have a difference in terms of alleviating those particular symptoms. But in order to achieve, if this is your goal, and it is most of the goal for my patients, which is healthy longevity, then you have to give physiologic amounts of estrogen. Now, what also is commonly done, giving in addition to a very tiny amount of estrogen of some sort, is giving nightly or daily, usually at night, progesterone. So they have learned that if you give a very small amount of estrogen and you give daily progesterone, in many cases, but not all, you will not have any vaginal bleeding. And they feel, hooray, success achieved. But yes, for that, if that's your whole goal. But once again, if your goal is healthy longevity, no, goal not achieved. It turns out that progesterone will do some amazingly important things, but if you give it continuously, you're continuously down-regulating estrogen receptors. So you're kind of like turning off the effect of estrogen. Now, if your whole goal is to not have bleeding, what must you do? give an amount of estrogen that is so low that it won't produce enough growth factors to create growth or proliferation of the uterine lining. Then you give daily progesterone, which acts as like the brakes and downregulates the ability of estrogen to actually have its effects, so that you end up not growing the uterine lining, and then you won't have any bleeding. Here's the problem. Estrogen, and it should always be given transdermally, it should always be in the form of estradiol. It creates many amazing effects in the body, but for that to happen, you have to give an adequate amount. It's that simple. One of the amazing benefits of estradiol is the stimulation of the production of growth factors. Now, growth factors in the uterine cavity will literally produce growth of the uterine lining, or we call it proliferation. But the growth factors that are created by estradiol elsewhere in the body may also produce growth. For example, growing new neurons, we call that neurogenesis, growing new mitochondria, mitogenesis, growing new bone. We need that to replace the old bone that dies and has to be eliminated. So there is actual growth, but it's even more than that. It's repair, it's maintenance, it's inner cellular rejuvenation, which we call autophagy. And alongside that is the elimination of yucky old cells, the senescent cells, sometimes termed zombie cells, the ones that create inflammation and also can potentially turn into cancer cells. All of this is part of the function of estradiol, but you have to have enough. So if you give enough estradiol, a physiological amount similar to the levels of an average menstrual cycle amount, if you look at sort of averaging the amount of estradiol through a menstrual cycle, you will have proliferation of the uterine lining, growth. You will also have all these amazing growth factors, including in the brain, in the bone, in the arteries, in the heart, you name it, everywhere in the body, to grow when needed, maintain, replace, maintain the stem cell pool, do intracellular rejuvenation, get rid of the old yucky cells, and so on. If you don't give enough estradiol to grow the uterine lining, then don't even think that you're having enough estradiol to do all these other amazing things in the body. And it's not just that. It gets much more complex. Estradiol optimizes immune cell function so that you keep inflammation down. Turns out that very little amounts of estradiol are not going to be anti-inflammatory. And you have to have an adequate amount to control unrelenting, inappropriate initiation of inflammation, which underlies all the diseases known as the degenerative diseases of aging. Now, how does a menstrual cycle really work? Well, you have the estradiol growing in terms of its amounts, and this is during the first half of the menstrual cycle, called the proliferative phase, when you're growing the uterine lining. Then you get the big spike of estradiol, which then causes a big spike of another hormone from the pituitary, luteinizing hormone, which then triggers ovulation. And then after ovulation, you produce progesterone from the corpus luteum, which is produced after ovulation. And progesterone downregulates the estrogen receptors. Estrogen, in the form of estradiol, upregulates its own receptors, progesterone receptors, thyroid receptors, testosterone receptors. Progesterone is like the opposite. It's like the brakes, you can think of it. And it stops the growth of the uterine lining, and then the progesterone causes it to flourish, kind of like flowering. They call it secretory, because you're actually doing what? You are creating mucus in the lining. So it's really amazing. Now, in terms of the period, everything in nature is like the yin yang and the Ayurvedic medicine, hot, cold, wet, dry, high, low, everything has its opposite. So progesterone is kind of the opposite to the growth of the uterine lining. It's like the brakes, and estrogen is like the gas. So if you don't want the uterine lining to grow, it's like you're trying to drive a car while simultaneously all the time putting on the gas and the brakes and then thinking you're going to get somewhere. You're going nowhere. So if you always have progesterone and you always have estrogen, the progesterone is going to act as a deterrent of the estrogen to do its thing. And you can't not grow the uterine lining if you give enough estrogen, so you have to keep giving that little bit of estrogen. And when you have a normal cycle, you always have an end if you're not pregnant, and the progesterone production ceases, the estradiol level goes down, and then you have like a purging of the uterine lining. That's the period. We call it the shedding phase, the menstrual cycle period. Now, when you're shedding the uterine lining, think of it like a purge through the whole body. You're purging not just the lining, but you're purging dead and yucky cells, like zombie cells elsewhere in the body. And potentially, as occurs in a real menstrual cycle, in breast tissue. And it creates this rejuvenation effect when you end up having that pause of estrogen. You're reading the estrogen receptors. So you have also, when you have the progesterone, you're turning on tumor suppressor genes. When you have the estrogen, you're also turning on tumor suppressor genes. But you have to have this yin yang. You have to have the pulse of the progesterone, not all the time, because it's really important to have these rhythms to have certain genes expressed properly. In order to have proper estrogen effect on the gene that causes cohesiveness of cells, that keeps cells from breaking off. If you have a developing cancer in the body, it keeps cells together. There's actually a gene that keeps cells together so they don't break off and then start circulating through the body. You need high enough amounts of estradiol to keep that happening. That's why even women who develop breast cancer, if they're on estradiol therapy, they have a better prognosis, because I can't say that I'm preventing cancer. I'm saying I'm most medically probably reducing the risk, but not eliminating the risk. So if somebody is on hormone therapy and they do get breast cancer, the medical probability is that they're going to have a better outcome. And when you have higher estradiol, you have more of that gene that keeps cohesiveness, so you don't have cells breaking off, causing metastatic disease, which is what kills people in breast cancer. So you have to have an adequate amount of estradiol to optimally function, keep everything functioning optimally. You have to have enough to create proper growth factors, to modulate the immune system so you don't have chronic inflammation. You're going to work with the gut microbiome. You have to have the right hormones for that, the right amount. So my motto is any hormones, even a tiny bit, is still better than no hormones. Absolutely. So if not having a period is essential and you say it's a deal breaker if I have any bleeding, that is your choice. I'm not here to twist your arm, but I want you to understand, if you want optimal benefits from hormone, you need to give an optimal amount, a physiologic amount. It is what it is. If you want an optimal outcome from being on hormones, you have to have enough. And it has to be enough to grow the uterine lining, because that is a sign that you're giving enough estradiol to grow other tissues of the body, to optimize their rejuvenation, their maintenance, and literally growing when you need to grow new neurons, new bone, and so on. So when you have this pretend period, it's real blood. By the way, it does not make you fertile. I wish I had that ability for my infertility patients who got into menopause and they want to have a baby. I cannot restore eggs. I cannot restore fertility. And it's not a real period because it's not from ovulation, but it's real blood and it's real benefit. So when a woman, one of my patients, she has controlled bleeding, it's not profuse, it's not painful, it's not many days, it's just a few days, it's very manageable. I say, celebrate. The hormones I'm giving you are working. They're actually creating benefit. It's not smoke and mirrors. You're not just suppressing night sweats and hot flashes, which I said, don't get me wrong, there is real benefit to that. But if you want more, if you want to be a super ager, if you want to have all your organs optimized, then you have to give the right amount and you have to give it with the beautiful rhythm of progesterone. You have to give it cyclically, and you have to live and celebrate that your uterus is acting young and it's creating bleeding, and that means all your organs are going to behave as if they were younger because they don't even know how old you are. If you give them what they need, they will do what they're programmed genetically to do. It's my secret. I'm sharing it with you. Cyclic hormones, physiologically dosed, is essential for optimal health. And I'm hoping that research will be done to get us more information for how we can optimize hormones and maybe mimic the menstrual cycle and understand the dosing and so on. But right now, this is where we are. And stay tuned. I'm sure things are going to get even better as more and more research and data is acquired. So this is what you should do. And by the way, if you want more information on this, I created a course which everyone can access if they want it. It's in my bio. It's on my website. It's going to be in the YouTube, in the notes. So if you want to take a course, and if you're not a healthcare provider, of course, you cannot prescribe it. You cannot access these hormones without prescriptions, but you'll know what to ask for. You'll know what you want, and you'll know how I prescribe them. If you are interested, you can acquire that course. So I want you to know that having a period that is pretend, but real blood, is a sign of functionality. The hormones are working. Your tissues are happy and doing what they should do. Your genes are being turned on properly. And you have the chance for optimal health span. That's what I want for everyone. Thank you for joining me.